Hey everyone, welcome to the Autoimmune Dietitian YouTube channel. My name is Annie Rubin. I am a registered dietitian nutritionist and owner of Annie Rubin Nutrition. It's a private practice that I run out of my home in the Bay Area. I see all my clients virtually right now. I work with adults struggling with a host of symptoms from underlying inflammatory and autoimmune conditions, things that include pain, fatigue, digestive challenges, and just an overall reduced quality of life. So in my work with my clients, I help them implement a personalized nutrition roadmap designed to improve mobility, concentration, and energy levels to help them live the life that they should be living. So today I'm talking about nutrient deficiencies. They are super common in autoimmune diseases. In fact, having a nutrient deficiency may be the reason why you're not healing as fast as you would like. But how do you know that you have a deficiency? So today I'm breaking down common symptoms that come with specific nutrient deficiencies and how you can reverse them. So before I jump in, I just need to attach a disclaimer to this video that the information in today's talk is not the substitute for the diagnosis, treatment, or care of disease by a medical provider. This is for informational purposes only, so please consult your qualified health professional for any changes to your medical care. This includes supplementation. As benign as you may think it is, a lot of times medications interact with supplements, so if you're adding a supplement to your kind of daily routine, definitely check with your doctor or your healthcare provider. Okay, so I see hair loss in my clients with alopecia, but also in some of my autoimmune thyroid clients. It's a very common symptom that many people complain about. Hair loss can be a very difficult symptom to deal with and manage, regardless if you're male or female. So generally speaking, hair loss is associated with an iron or a protein deficiency, or both. Autoimmune thyroid conditions are at risk for low iron status. So if you have one of those and you're experiencing hair loss, it could be related to your iron levels. So for people who have alopecia, having a low vitamin D status could be causing hair loss to accelerate. This makes sense because, as we know, low vitamin D status is associated with increased autoimmune disease activity. So if you're experiencing hair loss, definitely get your iron and vitamin D levels checked. Both of these are very easily reversible with supplements. You may need to take higher doses of them to restore your micronutrient status, so be sure that your healthcare practitioner is following up with labs and monitoring you very closely. Okay, the second most common complaint, actually it's probably the first most common complaint that I get from a lot of my clients, is fatigue. Feeling tired and having brain fog is super common, especially with autoimmune diseases. Fatigue can be caused by many things like food sensitivities, a sluggish thyroid, inflammation, to name a few. However, this could also be a sign of potential nutrient deficiencies. So the first one to consider is vitamin B12. B12 supports the nervous system, the production of red blood cells, DNA production, and is needed for energy metabolism. So when you're low in B12, your body can't produce enough red blood cells, which may leave you feeling really tired. Second, it could be a vitamin D deficiency. Vitamin D plays a critical role in your immune system functioning, and studies have linked vitamin D deficiency to feeling tired. Lastly, your fatigue could be due to a low vitamin C level. In fact, feeling tired is an early sign that you're not getting enough vitamin C. So, you also need vitamin C to help your body absorb iron, and both iron and vitamin C can affect your energy levels. So typically, if you've already checked your iron and you're not low in that, again, it could be something else. But iron is also one of those things that may leave you feeling tired if your status is low. So definitely the vitamin C and the iron together. So how do you fix these deficiencies? B12 is found in animal proteins, so include at least one serving of animal protein, and this includes dairy and eggs, at every meal. If you are vegetarian or vegan, you will definitely need to supplement. Vitamin D is best found in sunlight, but you can take a supplement. Vitamin D is very hard to get through food. And then lastly, vitamin C is found in your citrus fruits like oranges and grapefruit. It's found in kiwi and also strawberries. Okay, many of my clients suffer from dry skin and dry eyes, and even skin rashes like atopic dermatitis or eczema, or both. Again, some of these issues may be related to food, but it also could be a sign that you are deficient in vitamin A. Vitamin A is a fat-soluble vitamin that is needed for vision, for immune functioning, for skin health, and reproduction. In fact, many people with autoimmune digestive issues like inflammatory bowel disease, so like ulcerative colitis and Crohn's disease, as well as celiac disease, might be low in vitamin A. Additionally, if you are experiencing issues with fertility and having trouble getting pregnant, you may also be low in vitamin A. So a good reason to check your vitamin A levels. Vitamin A is found in brightly colored orange, yellow, and green plants. Think like carrots. It's also found in meat, dairy, and eggs. You need to be careful when you're supplementing with, both vitamin A and vitamin D because they are fat-soluble vitamins. You are at a greater risk for toxicity, especially if you're taking high doses. So again, always, monitor how much you're taking and get your blood levels checked frequently. Okay, the last one is depression and anxiety. So living with a chronic disease can make you feel depressed and anxious, obviously, but however, it could be related to a micronutrient deficiency as well. So selenium is a trace mineral that's needed for thyroid hormone production. It's needed for your immune system to function properly, and it's also really necessary for cognitive health. So low selenium levels have been tied to feeling depressed and anxious. These feelings could also be related to low magnesium levels. So practically half of our world's population is deficient in magnesium. It's mostly due to the fact that our soil doesn't contain the amounts of magnesium that it used to due to conventional farming practices and kind of the stripping of all minerals from the soil. But low magnesium levels have been linked to depression, anxiety, and even migraines. Selenium is really easy to replace. The only thing you need to do is eat 2 to 3 Brazil nuts a day. Brazil nuts are super high in selenium. Magnesium is found in leafy greens, almonds, pumpkin seeds, and cashews. If you do choose to supplement with magnesium, take those at night. Magnesium also helps you relax and fall asleep. So if you're having trouble, if you're having issues with sleep, magnesium is one of those great things that can help. So many of these annoying symptoms that come with autoimmune diseases may be an indication that your body is low in important micronutrients. You can have your doctor or healthcare professional run simple blood tests to investigate these further, or you can have a complete micronutrient panel run by a functional testing provider. I've done these for my clients and I've seen great results, especially when you know what to target. You can basically, customize your diet and tailor it to what your client needs, which is important. But in most cases, getting the right nutrients from either food or supplements can help you reverse some of these issues. So if you would like more help managing your autoimmune diseases or, inflammatory issues, please reach out to me. You can go to my website, annierubin.com, and click on a button in my contact page to schedule a free call. But if you like what you saw in the video and you want to learn more, hit the little subscribe button at the bottom to follow me. I put these videos out around every week or so, and I'm always, giving you another really interesting tidbit about nutrition and food and how to use that to manage your autoimmune diseases and inflammatory issues. So thank you so much for watching, and I will see you next week.